Welcome back, everybody. Today, um, we're going back in time a bit
Okay.
to the 16th and 17th centuries
All right.
to explore the world of surgery.
That sounds good.
Now, I think our listeners will be surprised to find out that
Yep.
surgery back then was vastly different
Oh, yeah. Very different.
from what we know today.
Right.
And imagine it was a world without anesthesia,
Wow.
where just surviving surgery was
Yeah.
never a guarantee.
Right.
But before we jump into the gory details,
Okay.
let's set the stage a bit.
All right.
Could you paint us a picture of what surgery was like back then?
Well, it's important to remember that back then, surgery was considered more of a craft.
It's a craft.
Yeah. It was a manual skill more than an academic study like what physicians would do.
Okay, so less theory and more hands-on.
Exactly. They were the ones working directly with the body, treating wounds and setting bones,
I see.
and performing procedures that, well, today would consider pretty crude.
That makes sense.
Yeah.
So how are these surgeons viewed in society?
It varied.
Okay.
They didn't have the same standing as physicians,
Right.
but they were more accessible to the different social classes.
I see.
So, if you needed a bloodletting or a wound treated, you'd probably go to your local surgeon.
And not to some fancy physician.
Exactly. And not everyone could afford those high society physicians anyway.
Makes sense.
So some surgeons struggled, but others, the really skilled ones, could actually become quite wealthy and respected.
Interesting. So it was a profession with a wide range of,
Yeah.
social and economic mobility.
Yeah, pretty much like today.
I can't talk about surgery in this time period without mentioning
Yeah.
the barber surgeons.
Right.
What a strange combination.
It does seem odd to think that the person cutting your hair could also be the one pulling your tooth.
Or lancing a boil.
Yeah. And in England in 1540, the Company of Barber Surgeons was actually formed.
Wow. So they brought these two professions together.
Yeah, they united these two seemingly very different fields.
So was there really much overlap in their work?
Well, there were some efforts to differentiate their roles,
Mm-hmm.
but barbers often performed minor surgeries, like bloodletting, wound care, even tooth extractions.
So basically, if you're already used to blood and sharp instruments,
Right.
minor surgery isn't that much of a stretch.
Exactly.
But what about the more complex procedures?
Well, those were left to the surgeons who had more extensive training.
So what did that training look like back then?
So to become a surgeon, you would have to go through a long apprenticeship
Okay,
under a master surgeon,
I see.
usually about 3 to 5 years.
Wow, so it sounds like a very hands-on, learn-by-doing kind of approach.
Yeah, exactly. The apprentices would assist in surgeries, they would attend dissections and listen to lectures, but the emphasis was really on practical experience.
So were there any specific areas that they would focus on?
Well, military surgery was a particularly demanding and sought-after specialty
Okay,
because, the battlefield was basically like a brutal training ground.
I can only imagine.
Yeah, and skilled surgeons could move up the ranks very quickly.
Right, because they were the ones who can handle the pressure
Right.
of treating all those battlefield wounds.
Exactly.
Now, beyond just the practical skills, how much did these surgeons actually understand about the human body?
Well, that's where things get interesting because this was, pre-modern anatomy.
Right.
But during this time, dissections, they became very important for advancing their anatomical knowledge.
And where did they get the bodies for dissection?
Mainly, they were using the bodies of executed criminals.
So scientific progress thanks to a rather grim necessity.
Exactly. And, those early anatomical texts, like the ones by Andreas Vesalius,
Yeah.
those really revolutionized the field, and they gave surgeons a much clearer understanding of how the body actually worked.
And I imagine having accurate anatomical knowledge
Oh, absolutely.
would have been essential for even, the most basic surgeries.
Yeah. And surgeons were actually fined if they missed a dissection.
Oh, wow.
So that shows you how seriously they took anatomical study.
It's fascinating how this emphasis on dissection
Yeah,
really paved the way for a more scientific approach to surgery.
it did.
Now, let's be honest. Surgery back then must have been incredibly painful.
Oh, yeah.
I mean, this was long before anesthesia, right?
Yeah, pain management was very limited.
So what do they use?
Well, they did use things like opium derivatives, henbane, mandrake,
Right.
but those offered very little relief and they often came with bad side effects.
I can't even imagine having to undergo surgery without any real pain relief.
It's hard to imagine.
What was the thinking behind using those substances anyway?
Well, they were chosen because they supposedly had analgesic and sedative properties.
Okay.
So like opium, for example.
Yeah.
They knew that it would dull the pain and henbane and mandrake.
Okay.
They were believed to make people drowsy or even unconscious.
So they were trying to ease the suffering, but
Yes.
their options were really limited.
Very limited.
And I guess people back then just had a different relationship with pain and suffering than we do today.
Yeah, because disease was so common and treatments were so limited.
Right.
They were just more used to dealing with physical discomfort.
That's a good point.
Yeah.
Now, knowing how risky and painful surgery was,
Right.
why would anyone even choose to have it?
Well, it really came down to a risk-benefit calculation, you know?
Okay.
So for people with debilitating conditions like bladder stones or really bad infections, they might see surgery as their last resort,
Right.
even though they knew how dangerous it could be.
So basically, desperate times call for desperate measures.
Exactly.
But amidst all this pain and risk,
Yeah.
there must have been times when surgery actually saved people's lives, right?
Oh, for sure.
So what were some of the things that they could do?
Well, surgeons were constantly working to refine their techniques,
Okay.
and they were always looking for new ways to treat wounds, set bones, and even perform internal procedures.
And when do we start to see some of the bigger advancements in surgery?
You know, it was actually during times of war that we see some of the most significant improvements. So the battlefield, as brutal as it was,
Yeah.
became a crucible for surgical innovation.
Exactly. Because military surgeons face such unique challenges.
Right.
They had to be creative. They had to find solutions to treat all sorts of injuries, and they had to do it under extreme conditions.
Wow, I bet.
Yeah. So it really pushed the boundaries of what was possible.
So what were some of those key innovations that came out of battlefield surgery?
Well, for one, they really refined techniques for trephination.
Trephination.
Yeah, that's where they drill holes in the skull
Oh, wow.
to relieve pressure.
And they did this on the battlefield.
Yeah, they even developed new tools like the trephine, which allowed them to be much more precise and have better control
Okay.
during this really delicate procedure.
I can see how that would be life-saving in some situations.
Oh, yeah, for sure.
What other innovations?
Another big advancement was with tourniquets.
Oh, yeah.
The early ones were just simple windlasses,
Right.
but they eventually developed more effective screw-based designs.
So better bleeding control? Much better. And amputations were also very common on the battlefield.
Yeah, I can imagine that.
And the techniques for performing them changed a lot, too.
So how do they change?
Well, they moved away from that brutal guillotine style, which was just a swift hacking motion,
Oh, wow.
to a more refined approach where they used flaps of skin and muscle to cover the wound.
So a more humane approach.
Yeah, and these innovations weren't just limited to battlefield surgery.
Oh, okay.
They actually made their way into civilian practice too, which really helped to improve the overall quality of care.
It's amazing how those battlefield innovations
Yeah,
led to improvements that benefited so many people.
it really is.
Now let's talk about the tools.
Okay.
What were surgical instruments like back then?
You know, the early instruments were actually more decorative than practical.
Really?
Yeah, they had fancy handles and intricate designs.
Interesting.
But over time, they started to focus more on functionality.
So a move from aesthetics to practicality.
Exactly. And the materials also played a big role. The quality of steel got much better.
Right.
So the instruments became stronger, sharper, and more durable.
So what about the instruments that we use today?
Well, a lot of those basic tools we use today, like scalpels, forceps, and probes,
Mm-hmm.
they all have their roots in those early designs.
Wow.
They've just been modernized.
It's amazing that some of those fundamental tools have stood the test of time.
It really is. And it's a testament to how those 16th and 17th century surgeons really laid the groundwork
Right.
for the advancements that we have today. I
Yeah.
mean, what they did might seem crude now,
Yeah.
but they were pioneers pushing the boundaries of what was possible.
With limited knowledge
Yeah,
and very few resources.
Right.
They were definitely trailblazers.
they were.
But what was it like to be a patient back then?
It's hard to say for sure because we don't have a lot of firsthand accounts.
Right.
But from what we can gather, people were very wary of surgery, and they would only do it if it was absolutely necessary.
Yeah, I can't blame him.
Yeah, I mean, given the pain and the risks.
Yeah, exactly.
And because people often waited until their conditions were really bad,
Right.
surgeons were often dealing with very advanced cases.
So they were seeing the worst of the worst.
Yeah, which made their work even more challenging.
I can imagine.
Yeah.
So I guess it must have taken a certain kind of mindset
Oh, yeah.
to be a surgeon back then.
Definitely, they had to be skilled and decisive,
Mm.
and to a certain extent, they had to be detached.
Yeah, I mean,
the realities of their job
Right.
demanded that they be emotionally resilient.
Yeah, I can only imagine the toll it took on them.
It must have been tough.
But there must have been moments of triumph too, right?
Oh, of course.
Like times when they knew they had made a real difference.
Definitely. And I'm sure those successes,
Yeah.
no matter how small, kept them going.
It kept them going
Yeah, it fueled their passion.
and drove them to keep innovating,
Right.
to push the boundaries.
It's pretty inspiring to think about those early surgeons
Yeah.
facing so much adversity.
But still driven by a desire to help people.
They were truly remarkable individuals.
Absolutely. And their legacy lives on
It does.
in every successful surgery that's performed today.
Absolutely. Every single one.
It's a good reminder that even in the darkest of times, the human spirit
Yeah.
of innovation and the desire to heal,
Right.
well, they shine through.
They do.
Now, before we move on
Okay.
to the next chapter of surgical history,
Right.
let's just take a moment
Yeah.
to reflect on all those pioneers who
Absolutely.
really paved the way for what we have today.
It's so important to acknowledge them
Yeah,
for facing those challenges and pushing forward
absolutely.
to make surgery what it is today.
Well said.
Thanks. Welcome back. We're about to jump into the 18th century,
Okay.
but we can't talk about that era without mentioning some of the key figures who really shaped the field.
Yes, let's hear about those surgical pioneers.
Okay.
Who should we start with?
Well, one name that comes to mind right away is Ambroise Paré. He was a French surgeon who completely changed the way battlefield wounds were treated back in the 16th century.
Oh, yeah, I've heard of Paré.
Mm-hmm.
Wasn't he the one who challenged all the conventional wisdom of the time?
He did. And, back then, the standard way to treat a gunshot wound was to pour boiling oil into it.
Boiling oil. That sounds just awful.
I know, right?
What was the reasoning behind that?
Well, they thought that gunpowder was poisonous.
Okay.
So they believed that the boiling oil would somehow neutralize the poison.
Wow, that's incredible.
Yeah.
I can't believe that was the standard treatment.
I know, it's hard to imagine.
So, how did Paré change things?
It was actually kind of a lucky accident.
Oh, really?
Yeah, during the Siege of Turin in 1537,
Okay.
he ran out of boiling oil and had to come up with something else.
So what did he do?
He made a gentler dressing using turpentine rosewater and egg yolk.
Oh, wow, that sounds a lot better.
And to his surprise, it actually worked.
So the patients who got this new dressing,
Yeah, they did much better than those who got the boiling oil treatment. Their wounds healed cleaner and with less pain.
so it's like a happy accident that led to a huge medical breakthrough.
Yeah, it really was.
It makes you wonder how many other amazing discoveries we missed out on because people were so stuck in their old ways.
That's a great point.
Yeah.
And after that experience, Paré really started to question a lot of the accepted surgical practices of his time.
I see.
So he became a big advocate for gentler techniques. And he always said that observation and experience were more important than blindly following the dogma.
He sounds like a real innovator, someone
Huh.
who wasn't afraid to challenge the status quo.
Yeah, he was.
Were there any other figures from that time who had this same forward-thinking approach?
Absolutely. So in the early 17th century, there was this English physician, William Harvey.
Oh, William Harvey, yeah. He's the one who figured out that blood circulates through the body, right?
Exactly. And that it's pumped by the heart.
What a revolutionary discovery.
It was. Before Harvey, people thought that blood just kind of ebbed and flowed like the tides.
Wow, so he completely changed the way we understood how the body works.
He really did.
So was he a surgeon himself?
No, he was a physician,
Okay.
but his research had a huge impact on surgery
Yeah, I bet.
because it gave us a much more scientific understanding of the body.
Right.
And that paved the way for a lot of advancements in surgery and in medicine in general.
It's a great example of how progress in one field can really have a ripple effect.
Right, it's all connected.
So with all these new discoveries and innovations popping up, did surgical practices start changing quickly?
Not really.
Oh, really?
While guys like Paré and Harvey were making huge strides, it still took a long time for that knowledge to spread.
Right.
I mean, back then there weren't any medical journals or easy ways for doctors to communicate with each other.
So it probably took years for new ideas to reach everyday practice.
It did, and those traditional beliefs, they often held on even when there was new evidence proving them wrong.
It's hard to change old habits.
Yeah, even in medicine.
So I guess that means that for most people who needed surgery,
Right.
things were still pretty rough.
Yeah, unfortunately, infections were still a big problem. Pain management was still limited, and they still didn't really understand what caused disease.
So surgery was still seen as a last resort.
Yeah.
With no guarantee of a good outcome.
Exactly.
It really makes you appreciate how far we've come
Yeah.
and how fortunate we are to live in a time when surgery is so much safer and more effective.
Absolutely. And it also makes what those early surgeons accomplished all the more impressive.
Right, because they were working with so little.
Yeah, with almost nothing.
And yet they kept pushing forward, trying to improve their skills and help people.
They were amazing.
Their dedication is inspiring.
It is.
Now, I know we've talked a lot about the challenges of surgery in this era,
Right.
but there must have been some successes too, right?
Oh, of course there were.
Like times when surgery truly made a difference.
Absolutely. Surgeons were getting better at treating wounds, setting bones, and even doing some internal procedures.
And each success helped them learn more.
Exactly. They were building on their knowledge with every case.
Those small victories really helped pave the way for the amazing advancements we see today.
They did. It's all about building on what came before.
So as we move further into the 18th century,
Yeah.
we'll start to see even more progress,
We will. It's a really exciting time.
filled with new discoveries and innovations.
Yeah, and a growing focus on making surgery more scientific.
It sounds like we're about to see a major shift in how surgery is understood and practiced.
We are, and I can't wait to tell you all about it.
Me too. Okay, so we're back and ready to dive into the 18th century when surgery really started to make some major leaps forward.
Yeah, this is when we really start to see a shift from surgery as a craft to something much more scientific and systematic.
So they were moving away from tradition and relying more on observation and experimentation.
Exactly, and one guy who really embodies this shift is John Hunter.
John Hunter,
He was a Scottish surgeon who's often called the father of scientific surgery.
another father of surgery. So what made John Hunter so different from the surgeons who came before him?
Well, Hunter wasn't content with just doing the procedures. He really wanted to understand why things worked the way they did.
I see.
He was a brilliant anatomist, a passionate experimenter, and he was a huge advocate for careful observation and keeping good records.
So he was kind of like a detective of the human body, always looking for clues and trying to put the pieces together.
That's a great way to think about it. He was really well known for his incredibly detailed anatomical drawings.
Yeah, I've seen some of those. They're amazing.
And his research on wound healing and inflammation was groundbreaking, and he really worked tirelessly to elevate surgery from a craft to a true science.
So he left behind quite a legacy.
Yeah, he did.
Did his work have an immediate impact on the field of surgery?
Well, even though it still took a while for new ideas to spread back then, Hunter's influence was undeniable. He created a very prestigious school of anatomy and surgery. And he trained a whole generation of surgeons who adopted his scientific approach. And of course, his writings continued to shape the profession for years to come.
So his impact wasn't just about his own discoveries,
Right.
but also about inspiring other surgeons to think differently.
Exactly.
Now, alongside these changes in how surgeons were thinking,
Yeah,
there must have been some developments in surgical instruments too, right?
absolutely. They made big improvements to forceps, scalpels, saws, making them more refined and more specialized for different procedures.
So what were some of the highlights?
Well, one big one was the invention of the lithotrite.
The lithotrite.
Yeah.
What is that?
It was invented in the late 18th century, and it allowed surgeons to crush stones inside the bladder.
So they didn't have to do open surgery anymore.
Exactly.
That sounds like a much less painful option.
It was a major breakthrough, and it really reflects this trend in surgery at the time toward less invasive and more precision techniques.
It's amazing to see how those innovations from the 18th century really laid the groundwork for things like minimally invasive surgery, which is so common today.
It really is. It shows you just how creative and dedicated those early surgeons were.
You know, despite all this progress,
Yeah.
there was still one major problem that they hadn't solved yet.
Infection.
Ah, yes, the invisible enemy.
Right.
Infection must have still been a huge problem back then.
It was surgeons still didn't fully understand what caused infection,
Right.
and they didn't have any standardized ways of preventing it. So even if a surgery went well, patients could still die from complications afterward.
That must have been heartbreaking for the surgeons.
And it was just a sad reality of the time.
So when did things finally start to change?
Well, it wasn't until the mid-19th century with the work of Louis Pasteur and Joseph Lister.
Pasteur and Lister, yes.
That's when we finally understood what germs were and how important it was to keep things sterile.
And those discoveries really changed everything, right?
They did. And then, of course, there was the discovery of anesthesia in the 1840s, which was just revolutionary.
Yeah, anesthesia finally meant that patients didn't have to suffer through excruciating pain anymore.
Exactly. And it also allowed surgeons to take their time, operate with more precision, and attempt more complicated procedures.
It's incredible to think how far we've come from those early days when surgeons had very little knowledge.
Yeah, they had such crude instruments, and patients had to endure so much pain.
It really has been an amazing journey.
It has, and it shows you the incredible resilience of the human spirit.
And the power of scientific inquiry.
Right.
But it's also important to remember that technology is only part of the story.
That's true.
At the heart of surgery is this human element.
Absolutely.
The compassion, the dedication, and the unwavering commitment to helping people.
I couldn't agree more.
Well, this has been a fascinating look at the history of surgery.
It has.
We've covered so much ground from those early barber surgeons all the way to the amazing advancements of today.
Yeah, it's been a real privilege to share these stories with you, and I hope our listeners have gained a new appreciation for this incredible field.
If you enjoyed this deep dive into surgical history, be sure to check out the show notes for more information. And if you want to hear more fascinating stories from the past, hit that subscribe button and join us next time.
Until then, keep exploring, keep learning, and keep asking questions. This is The Deep Dive signing off.